Words matter. How to address the negative impact of Elderspeak. Written by Waqar Ahmad, PhD, Leadership Diversity Fellowship, Leading Age and AG Rhodes. When organizations are changing their cultures and working toward implementing and integrating person-centered care and practices, how we speak matters. Words matter. It is vital that we understand Elderspeak, how it relates to quality of life and communication in long-term care settings, and how to address its negative impact. Staff can interact with residents in a controlling way that assumes the residents are incompetent and totally dependent on them, when in reality they are not. This form of communication is called Elderspeak. Elderspeak usually involves the use of inappropriate, condescending, or childlike speech with residents. Elderspeak may occur in subtle ways that are hard to recognize or detect during everyday interactions. Understanding how Elderspeak can have a negative impact on residents helps us recognize if we are engaged in childlike talk or patronizing speech. We can catch ourselves and change the way we communicate. There are 3 fundamental parts of Elderspeak that have a negative impact on residents: the use of diminutives, tag questions, and collective pronoun substitutions. Experts note that staff in nursing homes subconsciously and often with good intentions use a variety of inappropriate, patronizing, and childlike words and terms when addressing residents. These are called diminutives. This includes the use of intimate terms of endearment and implying a parent-child relationship. Examples of diminutives are when residents are called sweetie, dearie, honey, grandma, Miss Cutie Pie, Tootsie, baby, honey bunny, little lady, etc. This is especially challenging in southern and rural areas where these terms are often used in informal settings. Diminutives could also include nicknames or a shortened form of a name, as well as oversimplified words or exaggerated phrases. Using diminutives not only implies intimate relationships, but also demonstrates that there is a power gap between staff and residents where staff, consciously or unconsciously, put themselves above the residents. If we are not aware of the negative aspects of Elderspeak, we may mistakenly think and feel we are showing kindness or being empathetic towards residents. We can avoid diminutives by simply asking residents how they would like to be addressed. In general, it is polite and more professional to address residents with proper nouns such as Miss Catherine or Mr. Lawrence. It is imperative that we remember that all residents must be respected and treated as individual human beings. They should not be known by their infirmities or diseases, like the Alzheimer's patient or the wanderer. The second negative part of Elderspeak is the use of tag questions. It is common among staff in long-term care settings to ask questions such as "right?" or "wouldn't you?" These are called tag questions because when we do this, we have already decided what we want the residents to do, and we are prompting their answers or behaviors. When we assume that residents cannot act alone, not only do we undermine meaningful conversations, but we also take away their right to make their own decisions about their daily lives and suppress their autonomy. Now let's focus on how to avoid tag questions. Tag questions not only manipulate, control, and make the conversation one-sided, but they also convey a message that the resident is incompetent. We can avoid tag questions by asking questions in a way that respects their dignity and autonomy. Instead of asking a tag question like this, "You would rather wear the blue socks, wouldn't you?" We could say, "Mr. Lawrence, what color socks would you like to wear today?" If a resident is living with dementia, we can hold up 2 choices of socks and ask, which of these would you like to wear today? In long-term care settings where residents have less choices about their daily lives, especially as their health changes, it is up to us to help them express themselves and assert their autonomy and independence. Collective pronoun substitution is the third negative part of Elderspeak. When we use collective pronouns like we or our, we are implying that we are doing something together when we actually are not. Using this speech pattern is very paternalistic, condescending, and is another way that we can harm and take away residents' ability to maintain their dignity and independence. We can avoid using collective pronouns by using singular pronouns like you or your during conversations and interactions with residents. Instead of saying, "Are we ready to take our medicine?" or "Are we ready to eat our dinner now?" we should say, "Are you ready for your medicine?" or "Are you ready to eat your dinner now?" To address Elderspeak in your organization, the first step is to become consciously aware of the language we use when we interact with residents. We all must realize that the words we use and how we use them have an extraordinary effect on residents. Being aware of and eliminating the use of diminutives, tag questions, and collective pronoun substitutions helps us address Elderspeak in our organizations. We must keep in mind that residents are adults who have a lifetime of experience, knowledge, and education. It is up to us to do everything we can to help them thrive. How can you recognize and eliminate these negative parts of Elderspeak in your organization?